Neil, sound check.
They trust me.
Good morning or good afternoon, everyone. I'm Myra and sorry here for Wave Now. Hope your day is going well. We are going live to an update we're getting from Norton Healthcare about the opening date set for Norton West Louisville Hospital. It's being set for November 11th, 2024, so not very far away. They're holding a press conference to give us an update.
All right, ladies and gentlemen, I am excited to announce that we have an official opening date for our Norton West Louisville Hospital, November 11th, 2024. We are only about two and a half months away until you see what we're standing under the emergency department open, fully and ready to go. And so come November 11th, our full-blown hospital will be open. You will be able to be admitted. You'll be able to be seen in our emergency department. We've got the community rooms, surgical suites. Everything that you see behind me will be rocking and rolling. Super excited. Can I answer any questions so far?
What have you guys got to do besides going up to November 11th before you open your room? What are they just kind of finishing up around here?
Yeah, so as you can see behind me, we've got windows going in, a couple of doorways that are being finished up. There's greenscape, lots of beautiful roses and flowers and seating areas. So just a couple of quick finishes, paint, get the furniture moved in a couple of weeks, and then we'll be ready to go. Heavy equipment is in. We've got radiology equipment in, so CT, MRI, X-rays. We'll be able to do mammograms, plain films, the laboratory. They're working on the pharmacy right now. We've got all kind of things going in. What else can I answer for you?
I know you all posted about 3 vacant positions a few months ago. Where are you in that process as it relates to the opening date?
Yeah, so hiring's been a good time, actually. I like to brag to Russ a little bit that over 80% of our employees for West Louisville Hospital are external to the Norton family. And so instead of borrowing from our internal folks, we were able to give people in the community an opportunity to join our wonderful family here. We are staffed to the point where we are ready to open. There are a couple of opportunities to still be able to apply. Obviously, you'll go to nortonhealthcare.com/careers to take a look. We encourage everybody to take a look. You never know what you actually qualify for. So we've got staffing to open the facility, excited about that, and you'll get to meet a couple of those friendly faces as well.
What were some of those last little puzzle pieces you need to put in place to get that final date locked down?
Oh, my goodness. Well, it's been a solid date for a little bit. Just couldn't share that with you. We've got an amazing construction team with Harmon Messer. And they've been rocking and rolling. We know we've had a short deadline here. I told somebody the other day, our opening is actually almost 2 years exactly from when I was named for this position. And so it's coming full circle. Like I said earlier, those small details as far as making sure that we have our certificate of occupancy and moving in furniture. And then we'll bring all that staff that I talked about that we hired will come in and do run of show. Then we'll be ready for that first patient on November 11th.
Are you looking forward to that run of show? What do you think it's going to be like? Working through a new hospital, that's got to be a unique experience.
Yeah, I tell you.
Built all the time.
Oh, absolutely. Run a show looks like we are the folks that will come in and say, I'm the patient. I am going to say that this is going on with me, and our staff will say, this is what that process looks like. And so you don't just build a hospital and move people into it. You have to do all your checks and balances and make sure that you have everything ready to go, including emergency things and, what are we going to eat in the bistro? Those are the important things we do, right? But we'll be ready for first patient.
How does it feel almost fulfilling a dream for so many West Louisvillians who have been in this community and thought they would never see?
Yeah, you heard me mention the grass and the flowers. That sounds really, really small. But I'll tell you, one of the things that was mentioned on our survey was a lot of natural light and green space. And as you can see behind me and in the renderings of the videos and actually true to life here, something as simple as planting trees and having natural grass outside and even on our pavilion space upstairs, that's that dream come true, is that we kept our promise, right? We kept our promise on us opening. We kept our promise on the things that we offered, including the services, the Norton Medical Group space that's accessible inside the hospital, as well as something as simple as green space.
Is there an expectation, I know since it's so new, I don't know how you would measure this yet, but is there an expectation of how many patients you'll see each year that's relevant?
Yes, we do. We do calculate things like that. And to your point, it's a new facility. I tell you, as I like to say, we didn't just pull people out of the sky, right? West Louisville residents and people that live here, live right across the bridge in Indiana, they've been here. And this is all about access to care. And so bringing this hospital near just gives easier access. So it's not like we are looking for brand new people to come from anywhere. This is more about making healthcare accessible right in our own neighborhood.
Do you have a number you can share on how many people you expect to see each year?
Keep us busy. I don't have an exact number, right? We've been talking about this for 2 years, and we're going to continue to educate the public and our community on how to use the services. I've been doing a countdown with Corinza each week, and I'll continue to do that. We're on 10 weeks. Next week, it'll be 9 weeks, and we'll give more information. But it's really about, again, access and making sure that as those folks come through the door that we're ready for them, and I'm pretty confident that we are.
This facility checks off a lot of boxes in terms of services for this area. I'm wondering, which of your services do you anticipate being the most popular?
Well, I'll tell you what I hope is the most popular, and that is adult and pediatric or child primary care. And so I've said from the beginning that my hope for this hospital is that when you come in and we have to admit you or treat you in the emergency room, that is not the end of your healthcare journey. We want to get you established with primary care doctors so that it's a continuous journey to a healthier you. And so that, in my opinion, would be the most popular and what I would like to see people utilize the most.
And I'm sure you've studied this. I'm curious about your emergency services, how many patients you expect to see annually from this part of town making use of your emergency services.
Yeah. Again, don't want to give you guys a number because I don't want to, set any expectations outside of what we'll see come here. But I will tell you this emergency room is just like the rest of our Norton Healthcare emergency departments, and what comes through our doors we'll be able to treat.
Hundreds, thousands, I mean, just wild ballpark.
A lot. A lot.
Have you all stayed within that estimated cost of what it would be, or have we gone over like $1 million?
I would say I'm comfortable with saying that we are around the cost that we promised that we would do.
Russ, I know we might be retreading some ground here. Just talk about what it took to get to this point, man, and how you're feeling. I see your smiles.
Oh, wow. But first, thanks for being here. This becomes easy when you have a great leader like Corinza. And so much of what you're talking about is I stand here and look out at this block at 28th and Broadway. We may have named Corinza 2 years ago, but 3 years ago, I was driving during lunch down 28th looking for a spot that we thought a hospital might be able to be built in this part of Louisville. I looked over at an industrial site that really was in some disrepair and thought, could this possibly be? So for me today, to be here to look at the Goodwill Opportunity Center, the Norton Healthcare Goodwill Opportunity Center, and Norton West Louisville Hospital, it just reminds me of how transformational this is and how this could be a catalyst for so much more in West Louisville. So it touches me in a lot of ways, and I cannot wait for November 11th. Those of you who know me know that I can't have a meeting with Corinza or see her without saying, "You're sure we can't move it up a little bit?" Because it's never been needed more than it is right now. And the sooner that we can get open and serving people, the better.
We'll be ready.
It took a commitment, right? It's not just easy to throw up a hospital in 3.5.
You're absolutely right. And the commitment was we didn't want to build a new old hospital. We wanted to build a hospital that could sustain the future, provide services that looked at the future of healthcare. We desperately hope that we're able to build relationships and trust with a community where healthcare is not needed as much. We want people to stay at home and take care of their health, but we know that we have to have those relationships of trust to help people get into good habits to improve those health statistics in our community.
Any other questions?
Yeah, I was wondering when this project concludes and kind of wraps up, what's next for Norton Health?
Well, this project is not a project. It really is this facility is one that is a beginning point for us. It's a symbol of permanence. So much of what had been done for West Louisville in the past related to access had wheels, and it was mobile vans that moved in and out, and no relationships were able to be started. So next for us is executing beyond anybody's belief around excellence in this facility, making it easy for people to get here, building relationships. We listened so long in community meetings, and one of the barriers that we heard was the very uncomfortable conversation about your ability to pay. So one of the things that we've done system-wide is we've expanded our financial assistance policy and made it much more accessible. A family of four can make up to about $105,000 and have all their medical bills paid. So we've expanded that policy to get rid of that awkward conversation. But perhaps more importantly, we provided an opportunity for people to pre-qualify before you need health care, to get it all taken care of, everything taken care of, so that when you walk through that front door, the only conversation that we have to have with you is, why are you here, and come on back. So we've tried our best to look at every barrier that might exist and remove it. So next for us is executing on that, continuing to listen to figure out what's next, because there is a next sort of opportunity for us in this part of the community.
You're not the only healthcare provider in the region. What did you see in this neighborhood other than the need that made you invest in all of this?
It was really, it's a great question, David. It was really an opportunity around permanence. And we really looked at it from the standpoint of saying, all of the others, including us, have done things that are very itinerant. But has anybody actually, to use Reverend Cosby's example, put their mailbox in concrete in West Louisville and said, we're here to stay, we're going to be here, we're going to build trust, we're going to do healthcare differently than it's been done, because we want to change these statistics where your zip code is more influential in your lifespan than your genetic code. Right now in this community, there's a great disparity between those two numbers. So we saw an opportunity by permanence, by building trust, and by changing a narrative. And also, I want to add, our willingness to come here and invest as heavily as we did, we hoped would be motivation for other organizations to say, hey, it is worthwhile to do this, it can be done, and it can make a difference. And we've already seen that. We're already seeing that development take place. So what we saw here was an opportunity to do what was right for patients in this part of Louisville, but we saw an opportunity to also participate in economic development and do it in a different way.
All right, we can walk you around the perimeter if you all want to get some exterior shots, some other views of the building.
Do you mind if I took down the mask spelling your guys' names?
Yeah.
You know, we didn't do that.
Yeah, I was like, I did. I knew.
We just got right started.
Nice meeting.
Ah, cool. Thanks, brother. Are we wound up together? I think we are. Are we? There we go. Just was an optical illusion.
Over here. Hey, thanks for being here. Appreciate it. Thanks for coming.